Hello, I am Dr. Robert. I'm here to provide a detailed insight into the early signs of Alzheimer's disease. Alzheimer's is a progressive neurodegenerative disease characterized by the deterioration of brain cells over time. The disease typically starts with early symptoms and worsens gradually. Now, let's delve into the early signs of Alzheimer's disease step by step. Number 1. Memory loss. One of the most prominent symptoms of Alzheimer's disease is memory loss. However, this should not be confused with simple forgetfulness. In Alzheimer's disease, individuals often experience significant difficulty in recalling recent events. For example, they may struggle to remember the names of family members, friends' birthdays, or recent occurrences. Number 2. Difficulty making decisions. In the early stages of Alzheimer's disease, the ability to make decisions can be significantly impaired. This may manifest as difficulty making simple decisions in everyday life or experiencing indecision. Individuals may struggle to make decisions even in tasks as simple as choosing a meal or shopping. Number 3. Loss of time and place. Orientation. In the later stages of Alzheimer's disease, individuals may experience confusion about time and place. They may find it challenging to remember what time it is or where they are located. Particularly, they may experience confusion when going to familiar places or returning home. Number 4. Difficulty in verbal and written expression. As Alzheimer's disease progresses, individuals may struggle to find words or complete sentences. This can manifest as forgetting words during speech or having difficulty expressing complex thoughts. Additionally, they may experience difficulties in written expression. Number 5. Decline in visual and spatial abilities. Alzheimer's disease can affect an individual's visual and spatial abilities. This may involve misjudging the size or distance of objects, failing to recognize a picture, or getting lost during a journey. Individuals may struggle to perform visual tasks or get lost even in familiar surroundings. Number 6. Inability to recognize changes. Over time, as Alzheimer's disease progresses, individuals may become unable to recognize changes over time. This may involve failing to notice changes in seasons, important dates, or the aging of family members. They may have difficulty perceiving the passage of time. Number 7. Personality changes. As Alzheimer's disease advances, changes in personality may be observed. This may manifest as unusual behavioral changes, such as becoming more withdrawn or exhibiting increased irritability. Individuals may display a different demeanor than their previous personality. Number 8. Difficulty performing daily tasks. In the later stages of Alzheimer's disease, individuals may experience significant difficulty performing daily tasks. They may struggle to remember or carry out simple tasks, such as cooking a meal or doing household chores. This can lead to a loss of independence and significant difficulty in carrying out daily life activities. Number 9. Social isolation. In the later stages of Alzheimer's disease, individuals may avoid social activities or struggle with social interaction. This may involve losing interest in previously enjoyed activities or avoiding socializing with friends. Individuals may become increasingly isolated and have difficulty communicating with others. Number 10. Difficulty concentrating. In the later stages of Alzheimer's disease, individuals may struggle with focusing and sustaining attention. This may manifest as attention deficits, particularly in complex tasks or prolonged activities. Individuals may have difficulty concentrating or staying focused on tasks. These symptoms can manifest in the early stages of Alzheimer's disease, and the severity and prevalence of symptoms may vary from person to person. Consulting a doctor is important if there are any suspicions. Remember, early diagnosis and treatment can slow the progression of Alzheimer's disease.